Hi, everyone. Welcome. We are really excited to celebrate the work today that is driving resident and stakeholder engagement in Paterson and Pittsburgh. Just a heads up that we will be recording this webinar and sharing it with you all after this concludes. My name is Grace Pinnanen. I'm a delivery leader at Delivery Associates on our digital team. I'll be providing us a brief overview of how we'll be spending our time together. So we're going to start with a short introduction, and then we will dive into our two case studies on how Paterson is mitigating the opioid crisis and how Pittsburgh is revolutionizing their budgeting with priorities-based budgeting. And then there will be a group Q&A and discussion. We won't be stopping any of the case studies for questions, but we will be saving the questions that you can ask in our Q&A chat function on Zoom for this group discussion. And we'd like it to be as interactive as possible. So we'll invite you during this time to come off mute if you'd like to ask your question yourself or provide a response to what somebody else is asking. Also, you can use the chat function too if you don't want to go off mute. Before we get started, we'd really like to thank ResourceX. ResourceX is a technology company that has created a software to enable organizations to implement priorities-based budgeting. And they are a really valued partner who contributed tremendously for our work in Pittsburgh. And then we'd also like to thank NLC for hosting this webinar. And Annie, I'll pass it to you in case you have some remarks you'd like to make.
Great. Thank you so much, Grace. Hi, everyone. Thank you for joining this webinar today. My name is Annie Osborne. I'm a program director for strategic partnerships at the National League of Cities. As most of you know, NLC is an organization comprised of city, town, and village leaders that are focused on improving the quality of life for their current and future constituents. We can't do the work that we do without the support of our strategic partners like Delivery Associates. NLC's partners share our mission of supporting local leadership and provide critical expertise, resources, and partnership to our members. Delivery Associates has been a phenomenal partner over the last year, and the two case studies you're about to hear about demonstrate their commitment to helping cities with digital tools that facilitate everything from fighting the opioid epidemic to implementing priority-based budgeting. So thank you to Delivery Associates for their partnership and support, as well as to our speakers and city partners that are participating. So Grace, I'll turn it back over to you.
Thanks, Annie. Now it is my pleasure to introduce our wonderful speakers. Joining us today, we have Andrea Ramallo. She is a senior program manager for alternative public safety strategies for the city of Paterson. Patrick Cornell is also joining us from Pittsburgh, where he resides as the deputy director at the Office of Management and Budget. Will Bernstein will also be joining us from Pittsburgh in our Q&A section, and he is the climate and energy manager for the Department of Planning. Al Halela is our head of digital at Delivery Associates, and then Kip Harkness will also be serving as our moderator. He is currently the deputy city manager for the city of San Jose. Previously, he was the director of technology engagement at PayPal. Thanks so much, everyone, for joining us. And Kip, I will hand it over to you to get us started on our case study.
Thank you, Grace. We're just going to dive right in. And Andrea, I'd like you to talk a little bit about the city of Paterson. You've been leading many interventions, really, to reduce opioid use and overdose. Just give us a snapshot. What's the status of the opioid epidemic currently in Paterson?
Thanks, Kip. I mean, to be blunt, not great. We are seeing a little bit of a downtick compared to previous years. I think COVID had maximized a lot of the sort of internal turmoil that an individual goes through that exacerbated a lot of drug use and overdoses in general. So we are seeing a slight downtick, which is not a bad thing. However, what we are seeing is an uptick in individuals who are saying that they do not want to go to the hospital after being revived from an overdose on the street. So that's something that we are, because we're tracking and because we're looking at all this closely, we're able to see what those patterns look like and then adjust our interventions accordingly.
Well, diving in on that, talking about being able to see these patterns now, you've got a core team to respond to this, and it's trying to improve its interventions using data and technology. Can you give me a little snapshot of what it was like before you had these automatic data available to you, and kind of what it's like now, and give us a sense of kind of the change that's been for you.
Absolutely. So I think I could give a little bit of a historic snapshot quickly to say, so a couple years ago, there was this big, this group sort of created by the freeholder at the freeholder level for us, commissioner level now known as, at the county level, to basically say, look, what's the opioid epidemic look like in Paterson? How can we start to curb this, et cetera? And truth be told, not a lot of data brought to the table, right? So what that conference and discussion kind of ended up yielding was a lot of public scapegoating, shaming, stigma being, really perpetuated out there about who's using drugs, why they're using drugs, that they're coming from outside the city to come get those drugs. And so, it's the police's fault. It's the, richer towns nearby's fault for not addressing this. And there was so much finger pointing. And so when I came into this role and we started the Coalition for Opioid Assessment and Response, which includes ourselves, it also does include the county level, it could the prosecutor's office, it includes Health and Human Services at the county, Health and Human Services at the city, our regional health hub, which I don't know if other states have this, but it's basically a group that kind of watchdogs for Medicaid and sees sort of what patterns emerge in an individual who ultimately goes in for, or, ends up with cancer, what was sort of the pattern of Medicaid use prior to that. So looking at social determinants of health, and then also our hospital. And we're a little fortunate in Paterson because we only have one hospital, so definitely overcrowded, but it does mean that we can work very closely together and not have to, we can kind of keep our data a little more internal. Anyway, so the point being that group over the pandemic started coming together saying who's got what data, how can we start to put some truth to these narratives, and to dispel any misconceptions that have popped up. And I really think that that's the big difference between then and now. Now we know we don't really have to perceive what the issue is or point fingers about what the issue is. We know by data where these patterns are emerging and what exactly the epidemic looks like when you start to scrub out the falsehoods and start to really look at what's actually going on.
And when you start to have data that you can see those patterns together, you can debate and decide, you can gather insights. What do you see as the main results of having that data to inform your decision making? What are 2 or 3 things that maybe you've done differently now as a result of having a better through line into what's actually going on?
So we now know, we have a much more concrete understanding of who is overdosing, right? There's been this major debate for years now of it's non-Pattersonians who come to Paterson and overdose. Now that's true. And we now know that's true about 50% of the time, maybe sometimes 60% of the time. But we also now know, because we've really done a very good job at scrubbing our data, and I can show you the visual later on, but to look not just at who's giving us a Paterson address on the street, right? But is that a shelter address? Is it an empty lot? Is it an abandoned property? Those are the things that we now scrub for because we have the infrastructure, and now we also have the website and the platform to make that public. So now we can go to our lawmakers and say, hey, look, I know you all liked to assume that this was, quote, not our problem, right? So therefore not our resources that need to go into this. But realistically, it's 40 to 50% of the time a Paterson internal problem. And, you can debate, and I guess this unfortunately just sort of goes into a race question, but who is really a Pattersonian versus who's not really a Pattersonian. I don't really choose to get into those discussions. I say if someone has a legitimate Paterson address and they are currently living in this city, they deserve our support. And really anybody deserves our support, but at least financially from like the council's perspective and whatnot, that was the narrative that needed to change. So that was a huge one. Another really big one was understanding that, because there's this other perception, right, of everybody who's overdosing, it's only a couple people, they just consistently overdose. Not exactly true. When you start looking at, and we're not able to identify every single John Doe and Jane Doe, but when we are able to look at what we can, we see it's about 30% of the time where that's the truth. So there's 70% of individuals who are potentially a brand new overdose or someone who's new to the area. And we need to give them better education, and also the people who are repeatedly overdosing to maybe reach them a different way than we had been before.
Yeah, so you're really able to see these kind of different customer segments to be kind of techie about it and understand. It sounds like two major insights. One is it's not just outsiders, it's us as well, right? About 50-50. And then also it's not just the high flyers, frequent users, it's people who might be hitting this for the first time, and this might be their once and only time this happens to them in their life. It's not just a select few. And so you have to think about each of those groups, and there's probably a different set of interventions that is supportive or appropriate for each of those. It's very different from just these are all outsiders and these are all people who are doing this all the time kind of narrative. So very powerful. Let's take a moment. You've actually got some really amazing tools that you use and some ways of visualizing this data. I think we're going to turn it over to you and let you walk us through and highlight a couple of the things that you found impactful and show us what these tools look like in practice.
We're seeing a lot more older habitual users. And remember, this is overdose calls, so it doesn't necessarily mean opioids. It also, a lot of the time we see overdoses related to fentanyl laced in crack cocaine or even just normal cocaine, right? Someone who's just sort of trying to get their normal use and not expecting to overdose or potentially die from said overdose. And, we've been able to track closely enough to make sure that we're reaching the right populations when we know that there's a bad batch of something that probably that group would not be expecting to potentially overdose from. So if we scroll down here, I will say these are the tools that I'm most personally proud of specifically. So we have a heat map, right, showing temporal patterns of day, time throughout the week. We do see over time, though, which is kind of important, there hasn't really been a very consistent look at this heat map. So we're not really able to say definitively, yes, it's a 1st and 15th of the month issue. It's really more of an all the time issue. And it's something where, we used to sort of think, okay, Mondays and Tuesdays are a major hot day. We look the next year, it was, Thursdays, Fridays. So these are the patterns that we're trying to decipher over time, but having these tools makes it a lot easier. And I will just point out this one, this is about our addresses specifically. Like I said, previously, everyone would have assumed this is all non-Patersonians. Well, you're able to see here, this dark blue, it represents Paterson residential addresses that we've specifically completely documented are legitimate Paterson addresses, no questions asked. And it just has helped to shape the narrative and therefore help us target where our resources are able to come from and what we're able to do about it.
That's fantastic. I know we'll have a lot of questions from the audience and we'll get into more of the details in the panel, but I appreciate you walking us through that, Andrea. That's a really amazing use of those kinds of patterns to, as you say, reshape the narrative and again, focusing on what the real issue is. So I think at this point, we're going to shift over and dip into the next case study. And we're going to take a look at the city of Pittsburgh, both around how they used this work in terms of budgeting and also engagement. So I think that I'm going to have Pat joining me here. And I know the city of Pittsburgh has transformed and shifted from kind of traditional line item budgeting to priority-based budgeting. And I would love you just to start talking a little bit about that. Why go to performance-based budgeting and what was it like before? So a little bit of the before and after there for me, Pat.
Sure. Hey, everyone. Thanks for having us. Really excited to talk about this. I know budget people love talking about budget, right? The most glorious thing in the world.
That's where the money is.
Exactly. So traditionally, we did have, a lot of line item budgets. A lot of it was based on known contracts. A lot of it is based on, here's just a bucket of dollars that are used for things like supplies. But it is often hard to really break things down further than that. And so the idea with shifting to priorities and programs is to have a better sense of, okay, how much of this bucket of supply dollars is going towards Parks and Recreation's aquatics programs versus their, park ranger programs, things like that. And what we have found is that this allows both departments to have a better sense of what they're actually doing with their dollars, and have a clear list and an inventory of their programs and their activities. And then that translates into, okay, how do we let residents know that this is where their tax dollars are then being directed? So it's definitely a shift. It's a work in progress. We still have some aspects that are related to line items just by the nature of right. What it is. But it's been the start of a really interesting journey.
Well, and you mentioned both the internal aspects of it, which are obviously super important in terms of management and the operations, but you also are using this as an engagement tool and as a way to help the community understand the budget more and also be involved more. As you mentioned, while people are interested in money, it can often get pretty boring talking about different sources of funds and restrictions on this and the other. How did the city use some of these data tools and display work to better communicate the understanding of the budget and to engage with the community? I'm very curious about that.
Sure. So we're using these tools strictly for the operating budget at this point. The capital budget always had a more robust community engagement. It's always easier to point to a pothole or a stop sign or a building or a retaining wall, right? The operating budget is always a little trickier to wrap your hands around. What do pension payments really mean with respect to a taxpayer? What does debt service mean? So finding ways to connect them. What we are doing now is, we've launched this new tool, public facing, that really identifies Mayor Gainey's priorities and relates them to each program, at a snapshot in time as we're working on the budget. So obviously for right now, fiscal year 22 is still up. We're working through fiscal 23. And the goal is to just take something, a 400-page document, that is really just line after line of numbers and dollar signs, and kind of depict it in a way that makes sense, right? So using, just the idea of this block is larger because that represents a bigger piece of, the budget for the department. Just being able to take a quick look and have an idea of how it relates, not only with the budget, but the mayor's goals at the same time.
Yeah, no, this is super interesting. I think a lot of the interesting ways on how we actually process information with our brains suggest that we're built as visual animals, right? And we can absorb actually a tremendous amount of data if it's well presented visually. But if it's a bunch of numbers in a 400 or, for our case, 1,000-page document, there's very few people who are going to have the time and inclination to wade through that. So rather than talk about it, let's actually take a look at it. You've got the tool. You're using the tool. I think Grace is going to walk us through this. Why don't you tell us a little bit about what we're seeing, Patrick, and what's going on here?
Sure. So DA certainly knows how to build visual tools way better than I ever could. So here you see what are the priorities for the operating budget. In the past, they had always been, kind of implied. They were there, but here now they're front and center. They're clear. Each of these categories has, safe neighborhoods, welcoming communities, thriving people, three big overarching ideas. And then each one of those then has a little bit of a more specific definition. So just being able to see it, I think, is one thing that's new for us as we move through the operating budget. And then the meat of the tool, if you go into Explore, you can click through each department. There's the Bureau of the Police, here's the Bureau of Fire, here's EMS, Emergency Medical Services, Mobility and Infrastructure. And from there, you can move through and see what the programs are. Some departments really took to the idea of programs and created their inventory. You can click in here to street resurfacing, paving. So what on the operating side is related to paving? You can see how these align with the priorities that Mayor Gainey has created for us. How has it changed over time? That's going to be an interesting one as we keep tabs of this. And what percentage of the city budget is it total? I like these comments at the bottom. Is this something that's mandated by the federal government or the state government, and who is impacted? Right. That's another thing. Is it a lot of people, a lot of residents, a lot of visitors? Obviously, with something like paving, yes. These are our roads, and the emphasis here is really figuring out, okay, where can we get our most value added? Obviously, being required to do something is different, but what we want to do is make sure that the most impact translates to serve the most and the greatest number of residents. Sure. So one thing that you could see a few seconds ago was news and resources. If there's press about what we're doing. When I started with the city, we were very much an internal facing office, right? Like, we're working with departments. Sure, we produce a budget for the public. but also, for our city departments. And now we've really shifted into the idea of, okay, I need to think of my team as external facing. We need to interact with residents. How do we do it? What's the best way to get there? So I also wanted to just highlight the FAQ. Why is the budget matter?
Yeah.
And then we start to tackle the education portion of it with some basic questions that then hopefully lead to a little more specific questions. And then, what we really want to see is a population that knows where their tax dollars and other sources of revenue are going and how they translate into expenditures.
Yeah, this is really interesting. We have a city manager form of government, which is a bit different. But one of the things that they train us in city manager school is that your role, my role, we're kind of in the gap. And many different gaps sometimes. And one of the gaps is between the elected officials and the community perspective and the bureaucracy and the organization's perspective. And the way that I've been told and educated on that is that, the elected officials are there, they live in the world as it ought to be, right? They've been elected to change things and make things better. The organization is often in the world as it is. And so you really have to bridge this gap. And also the organization works in terms of data and procedures. The external world, the electeds and our residents are in a world of story and actual experience. And so it sounds like you're very intentionally creating a tool that bridges the gap and works for both the internal organization to need to understand its numbers and its data, and the external community, which needs to understand the why and more of the story around this. It's very powerful. I'm just curious, as I've described that, how does that resonate with your experience, or is that the way you see your role?
No, it is certainly, using the education from this tool, right? We'll then partner with our surveys and our community meetings and our budget 101 sessions. This year we have a September budget and a November budget, and we're really going back out into the community during the month of October to just get some feedback. Yeah. Right. Like we started with feedback in the beginning of the summer. We're going to do our first draft, do some more feedback, and then the mayor will present his budget to council. So it's really just one piece of the puzzle with respect to how do we work towards a more engaged community.
I'd be curious, and we'll get some of the Q&A, but what has it been like for you personally to see the data in this way? What are some of the insights that you've had about your own city budget that you might not have had if you hadn't seen it presented in this way? Anything come to mind?
Sure. I mean, I had to go through the program myself, right? So I split up OMB's budget into our various programs, operating and special revenue, capital, procurement, management, et cetera. So I was participating, right? And one of the things that was really cool too in our work with ResourceX is that you allow for the opportunity to just kind of create new ideas that are associated with each program. Mm-hmm. So we had city employees from every department who was participating, kind of taking a look at my OMB budget and saying, hey, this is where I think we could improve with respect to climate or equity. So it was really, really interesting and useful to just get the insights of my peers with respect to what I'm working on, and then being able to offer my opinions on some of their programs as well.
Right. This goes back to that point again, where I've been trained is moving from patterns to insight. Right, is that the data can give you the patterns, but it's really the people who understand the work who can derive the insights from those patterns. So if this creates the opportunity to have these kind of conversations with your peers, which might normally just be in a memo that you send off somewhere, that's a huge step forward in terms of being able to strategically work together, especially when those people in turn are responsible for actually implementing the work. All right, I think this is great.
And,
Thank you so much, Kip, for moderating this session, and to all the webinar participants, as well as our panelists who, for us, are heroes. We worked with them during high pressure times. So, we see these tools at times in early stages in terms of what we call minimum viable products, like what Kip was talking about in terms of agile development. As Pat is aware, for the Pittsburgh, the tool was set up in a matter of weeks. And so we are excited to continue that work and hopefully scale it, as well as, of course, the good work that Andrea and the team have done in the city of Paterson. So you all are aware, Delivery Associates, and in particular, Delivery Associates Digital, is on a mission to support cities both across the US and the world to do it efficiently and effectively using technology and data. If you're interested in these case studies or any more of our work, please contact us. We want to get into dialogue with partner organizations, cities, and hope you all have a great rest of the day. Thank you, everyone.